For years, those of us who suffered from varicose veins had few options for treatment, often limited to surgery or painful saline injections. But since that time, much progress has been made that's opened up an array of appropriate treatment options. Here to tell us more about these developments is Dr. Nick Morrison, co-owner and medical director of the Morrison Vein Institute. Dr. Morrison, welcome to the show.
Thank you very much.
Dr. Morrison, why should one be concerned about their veins, and when should they be checked?
There are really two reasons to be concerned about veins. The first is symptoms. The veins are simply showing what is happening underneath. So there are problems with the veins that are underneath, and then you see the veins on the surface. But it's the symptoms that are really the reason to seek treatment. Symptoms of pain, itching, swelling, restless leg, those sorts of things in the legs can be the result of the underlying venous problems. The second reason is sequelae. So things happen with veins because without treatment, veins only get worse. And if you don't treat the veins, you may end up with some of these problems later on, which include clots, both in the superficial and the deep system. It can include open sores or ulcerations, and even spontaneous rupture of veins with profuse bleeding.
Now, in the past, there were very few options outside of surgery to treat vein disease. What procedures are there now, and how much downtime should one expect?
Procedures include what they call thermal ablation. So under local anesthesia, we heat the vein up using either radiofrequency or laser energy to make it shut down so you don't have to tear it out like you do a stripping procedure. The second option is something called ultrasound-guided foam sclerotherapy. So we actually insert a needle into the target vein and inject a foamed sclerosant, which will allow that vein to shut down. The third option is something called microphlebectomy. So for the very large varicosities, we make these very tiny incisions, reach into the tissue with a special instrument, and take out the vein. All of them require at most a day of recovery, and then patients are right back to the full activity the following day.
Now, are there any immediate conservative measures that you can take to reduce symptoms of discomfort and the risk of a blood clot? And what are the risks while traveling?
There are several things that you can do. The first is exercise. Exercise really improves symptoms. It doesn't do anything for the underlying problem, but almost any aerobic exercise will help. The next thing is the wearing of compression hose. And these are not your grandmother's compression hose. There's some very stylish medical compression hose that can be worn above or below the knee that will help symptoms. And the last is leg elevation. Sitting down and getting the legs elevated will also relieve symptoms, but remember, none of these things are going to correct the underlying problem. And the last thing is travel. There is a risk of clot either in the deep or the superficial system when you travel, so being active during the travel, for example, doing calf raises or walking around, and especially the use of below-knee compression hose will all minimize your risk of a blood clot.
Dr. Morrison, thank you for this extremely valuable information. We really appreciate it.
Thank you very much.
There's more information on varicose vein treatment and educational materials at www.morrisonvein.com.